Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back. In this episode, we're talking about how to manage remote employees effectively. Wow. This is a topic if I've ever had one. So obviously, pandemic hits. The desire for remote work has significantly increased. It's been driven by widespread adoption of remote and hybrid work models. Below are some key statistics reflecting the percentage of employees desiring remote employment. And you're going to see it is dramatic. So 98% of workers expressed a desire to work remotely at least part-time in 2023. That's crazy. 98%, highlighting a strong preference for flexibility in work arrangements. Imagine if 98% of our workers were remote. How would we didn't need to have robots in healthcare places, robots in restaurants, you name it. But that desire is driving a major shift in the way that we hire. The other statistic that I want you to keep in mind is 97.6% of employees wanted to work from home some days in 2024, with only a small number of employees favoring a full return to office-based work. 70% of employees indicated they would accept a pay cut to retain remote work flexibility in 2025, with 42% willing to take a 10% or greater reduction. Now, I'm going to play on this for a sec because it was so interesting. I was on the baseball field the other night, and one of the kids' moms was talking to me, and she said this exactly. Brandon, I took a $30,000 pay cut so that I could work from home full time. $30,000 pay cut. That's a big pay cut. That is a sacrifice people are making. This is not going away. Now, I want to be very clear. I think being able to offer remote work is an opportunity if you can, because I know not every, private practice can do it. I am a big believer that every single business function in a practice can be remote. Collecting pay, processing pay, billing, scheduling, following up with clients, sending stuff, etc. The only thing that is what I'm going to say controversial is what can get done on a medical model outside of the office. So, obviously, like one day, could there be blood draws that are fully electronic robots? Yeah. The role of a medical assistant, it would be hard for me to see that as a remote employee. Maybe it's possible. I haven't seen it yet. The role of a doctor, we got telehealth. That is a piece, but there are some functional tasks that are required. But what if some of these people had the ability to work telehealth and work in a clinic setting? There are many benefits to that. One of the things that we saw is that 25% of employees stated in 2025 that they would only consider fully remote roles for their next job. They're even refusing hybrid or in office. This is pretty dramatic. Now, so our administrative employees went virtual or remote before the pandemic. I saw a shift before the pandemic hit. The pandemic just made it a trend. What I recognized was that employees were losing time in their personal time with commute, and that a lot of them were actually less productive in the office. I ran a 3-month study. And in that 3-month study, I said, what is the percentage of tasks that get done when they're all in an office versus when they're not? And for those who don't know, like over the last 10 years, there have been studies on whether employees are more efficient in cubicles, more efficient in open office, more efficient in private offices, all of that. In my own studies, every single employee has been more efficient via remote work than in office. Now, part of that is the structure, part of that is the accountability, part of that is they have to earn that ability. But what I recognized is they're not getting stuck in water cooler talk. They're not getting stuck in what did you do last night and where are you and all those things. And there's a lot that happens in a snack break room. So the problem that I did see is the employees were able to actually take on far greater tasks on days when they worked from home. But those that worked 5 days remote felt more disconnected from the team. So I felt that the employees that were working 2 days in the office and 3 days from home had a better balance of job satisfaction because they wanted that relationship with team members and employees, et cetera. And so I think it's critical that we think outside the box. I think healthcare offers remote opportunities. And I think sometimes we don't recognize what is possible. And so at this moment in time, every single one of my employees gets to work 100% remote. I have an office that they can go to when they want to go to, and we have structured meetings for connection. And I have a clear set of guidelines that they have, both for HIPAA protection, privacy protection, how we set up their offices, but also the structure of what is fair and reasonable to get done, where there's flexibility in their ability to take time off or change their schedule per day, when time is required to be a set schedule, when it's not. And what we have found is that job satisfaction's on the rise, performance is on the rise. And here's the other thing. I've had many employees where I said, if I brought you back into the office and you could make more money, would you want that? And they said, I'd rather stay at my current structure. And so the other thing I've recognized is I've been able to expand beyond our region and hire in other states. And yes, it's a pain in the butt to set all of that up. But the benefit that I'm seeing is I'm able to hire higher quality talent at a lower expense. And I'm able to optimize the productivity as a result because the benefit of flexibility and working from home is far greater. And when I've asked my employees if they had to choose between paid time off and 100% remote work where they could schedule and change their schedule in a way to work from home, which one would they prefer? They would pick remote work over a 2-week PTO benefit and working from an office. That's a pretty dramatic change from where it was. So these are things that I want you to think with. Telehealth and virtual care is being adopted by patients. We're seeing it change. 37% of US adults aged 18 and over used telehealth in the past 12 months, and that was in 2021, according to the National Health Interview Survey. Women, 42% were more likely to use it than men, and usage increased with age, peaking at 43.3% utilization for those that are 65 and older. 80% of Americans who engaged with the healthcare system reported having access to telehealth at least once by 2022, per Rock Health survey, indicating a widespread adoption. In 2024, 78.6% of U.S. hospitals connected with patients through telehealth services, establishing telemedicine as a standard component of patient care. Additionally, 116 million users expressed a preference for virtual consultations, reflecting significant patient adoption of telehealth as a regular resource for medical needs. So get this, 2025, what is one of the trends that I am seeing? I am seeing insurance now try to reduce the coverage of telehealth, trying to reduce the reimbursement of telehealth, trying to deter providers from using telehealth. Why? because with patient adoption means more money being spent. And so, from my opinion, insurance companies are threatened with the amount of money they're spending in telehealth. And so, by limiting that, they're able to limit how much they spend, because things that normally would take an appointment and sitting in a waiting room and all of that, like I don't feel good or this or that, people are now doing with telehealth. And insurances recognize that if they don't offer telehealth, there's a handful of people that won't go to their doctor at the same rate. My belief system is that telehealth can be an efficient way to screen the needs of a patient, reduce exposure of sickness in a waiting room, and optimize the way that we schedule patients and what care they need. So if every patient was able to have a screening via telehealth and the doctor directs next steps accordingly, we would have more efficient, effective, and proactive healthcare. I am a huge believer that telehealth, when utilized effectively, can change the way that we overcome medical conditions in today's environment. And so here are some different examples of virtual workforce. We've got practitioners, MDs, nurses, therapists, clinicians, all using telehealth. We even have surgeons now that are using robotic surgery hands to do a surgery, and that they're able to have a more precise surgery done because they don't have their shaky hands. And we're seeing better outcomes in other countries as a result. Telehealth also provides us an opportunity to bring specialists from all around the world to help solve some of healthcare's biggest barriers right now. Our administrative staff can get solved by virtual. We can have our schedulers, we can have our medical billers, we can have our HR. I can hire an employee anywhere in the world without ever physically being with them. And I know you're like, well, Brandon, what about human connection? We can have a human connection. I can send them a cup of coffee. I can have a cup of coffee. We got the screen. We're okay. And I'm not saying that in person isn't valuable, but I am saying that there is a point in this world where people are using the world to experience life, and they want work to be more structured in their own flexibility of their home or their work conditions. Did you know we could use virtual care for training, mentorship, educators? So one of the businesses that I manage, we have nurses and physicians and clinicians going into the home and home health and all of that. And we can mentor other practitioners all over just utilizing telehealth mentorship. Marketing can be done telehealth. So my challenge is, can you create a more optimal patient experience by leveraging a virtual workforce office? See, that could be employees, that could be offshore, that could be a combo. I am a huge believer that the patient experience can be transformed in a positive way when you're not getting stuck with the octopus of office managers who's answering the phone, greeting the patient, checking them in, and all of those things. In today's environment, we have an opportunity to create a patient experience that's transformative. Imagine if patients checking in are able to be greeted virtually. Welcome to our clinic. We're so happy you're here. We're going to alert you the minute that your doctor is ready. 5 minutes till your doctor is ready. You show up, you're ready to go. They take you right in. And so the first experience you have is not with other sick patients. It's not with a receptionist. It's with your doctor. And I say it this way because the most painful patient experience that I have is right now currently with, in my opinion, dentists. I think the dental experience is the worst experience of any medical setting. And I think the best experience are these functional medicine where you get connected virtually and then you get directed right into an office without any waiting. And I say this because even this idea of, we'll leave healthcare for a moment. I love the idea. One of the things I do, you may not like my haircuts, but I'll say it this way. when I go in and get a haircut, I'm one of those people, I'm like, I'll just go to wherever it's convenient. I don't want to schedule it. And I love the idea that I can get on an app, I can find availability, I can plug in, it tells me how long, it tells me to check in from my car. I go get it, I'm good to go. I do that with my haircuts. I do that when even I'm getting food with my kids. Like there's just an experience now where I don't want to sit in a crusty, musty environment. So, unless you're creating a really unique, what I'm going to say, leveraging spa like experience, most waiting rooms and most patient experiences are more transformational when they're virtual and technology based, from my opinion. For the past 20 years, I've had the privilege of helping pediatric occupational, physical, and speech therapists redefine the way that their business functions and helping them tap into their entrepreneurial spirit. In recent years, I recognized a deficit, which was bringing private practice owners together with the vision of allowing them to connect, learn, and grow. And Growth Code Conference was born. From sunrise to sunset, we offer an opportunity for pediatric, occupational, physical, speech therapy private practice leaders and owners to connect, collaborate, learn, grow from yoga to breakfast to lunch to coffee carts and more. We take you to another world where you are inspired, where you feel empowered, and where you are able to grow to the next level so that we all can change the world one child at a time. And so a lot of you are afraid to outsource your business. And by outsource, I mean they can still be W 2 employees, they can be whatnot, but bringing it outside the office and making it virtual. And part of it is you're concerned, well, Brandon, what if they're like caring for their baby? What if they're watching soap operas while they work? What if they are, going grocery shopping and I don't know? Like, how do I measure that? And so you're already starting in a world where you don't trust. My viewpoint is if you hire the right people, they earn trust. But we need to set up structure and strategies built on accountability. So, number one, we have to set clear expectations and goals. Define specific, measurable objectives for each virtual employee. Align them with the practice's goals. Use tools like SMART goals, specific, measurable, achievable, relevant, time bound, to outline tasks, deadlines, and performance metrics. For example, a virtual receptionist might have a goal to respond to a patient inquiry within the hour or within the 24 hours or whatever that might be. At the end of the day, you can measure that task management. And in today's environment, the technology is there to help support where you can actually evaluate function, both electronically, phone-wise, computer-wise, etc. Step two, I want you to implement regular check-ins and progress updates. I want you to schedule consistent one-on-one team meetings via video calls to review progress, address challenges, provide feedback, weekly, bi-weekly check-ins to help maintain accountability. Use project management tools. I'm a huge Monday.comer, some of you like others, but tracking tasks, ensuring transparency, whether you're using Monday or ClickUps or Asana or whatever it may be, you can program every single click to be measured and automated. It's there. It's available. There's consultants that can build your whole ecosystem, your whole workflow, everything. Use technology for transparent tracking. Leverage software to monitor work hours, task completion, productivity. And it's a report that gives out. There's tools like ActiveTrack that allows employees to demonstrate their contributions while fostering trust. Ensure that employees understand the tools are for support, not surveillance. And I think that's critical because I know that anytime I've had an employee that has not been a really strong employee, they've always felt like I just don't understand. I hate that statement. You just don't understand, Brandon. I'm like, help me understand. I want to understand what's getting stuck. So the first question is, do you want to work harder or not? That's the first question. Do you want to work harder? Well, it depends. What does it depend? Well, I want to enjoy my job. I'm like, well, you can work hard and still enjoy your job. What is hard for you? What is easy? What would your ideal job look like? The issue when I run into people who say, I just don't understand, is that they don't want to help me understand. I had an employee that said her job was so hard, so much work, etc. We had 3 different employees do the job when she left. It was less than 10 to 15 hours a week of work that she took 40 hours to fill. What was our mistake? We had the wrong employee, with the wrong accountability measures. And the more that we pushed on her, the more we recognized that she just didn't want to work that hard. So you can't have great work remote employees if they don't see it as a privilege. And the privilege is earned, and it's earned through accountability. And we help provide resources to highlight how efficient and effective they are able to function. Our job is to get the most value from every minute you work. That's the reality. Your job is to create the most value for the time that you work. My point in this is the more value that you're able to contribute, ideally, the more revenue, the more earning potential, the more opportunity. So understanding that, I think, is really critical, and utilizing technology for transparent tracking is really helpful in that process. The next thing I think a lot of us forget is we need to foster a results-oriented culture. We need to focus on outcomes. We need to show them what the results we're looking for and what's acceptable. And there is a point where I say, hey, this is the fair and reasonable outcomes that I expect within 40 hours a week. Okay? If you can get it done in less, then you have a choice. You can either take on more and earn more value, or you can clock out and be done. But I put a certain budget on those outcomes. And if you want to slow play it for 40 hours, that's your choice. If you can do it faster and take on more, you'll be worth more. But encouraging virtual employees to take ownership of their deliverables, such as a marketing staff member launching a patient outreach campaign by a set deadline. That's a results-oriented component. Recognize the achievement to reinforce accountability and motivate continued performance. Let these employees understand their financial value based on their task management, based on their accomplishments that they're going to do, and how that drives change in the organization. So I've talked about this in past episodes, and I'll bring it up again. One of the ways that we're happy is when we experience progress by having a subset of expectations that must be completed on an hourly, daily, weekly basis with our staff. We're not only able to hold them accountable, but we're able to help them feel and see progress. And part of that is that results-oriented culture. It's really important to provide training and support. I think that's one of the areas where we don't shine. When someone is remote, we forget what training is required. We forget how to have those check-in meetings. We forget to ensure that they feel they have all the tools, resources, and training needed. So equip your virtual employees with skills and resources needed so that they can succeed remotely. Offer training on time management, virtual collaboration, practice specific tools. You need to regularly support your employees so that they feel confident, that they feel that they can be held accountable, and that you're able to reduce procrastination and disengagement. And I think that's really critical. So when we're creating this culture for remote employees, we need to promote open communication. They need to feel connected to you. That's the hardest piece. So everyone thinks that having remote employees, the challenge is knowing what they're doing and are they doing enough, and accountability and are they doing everything they're supposed to do. I think that's the easy part. The hard part, making them feel part of something. Making them feel like you are so important to everyday life that they would jump over mountains for you. That human connection gets lost, and it takes a ton of work to get it. So build a culture of trust and inclusivity by encouraging regular, transparent communication. Use tools like Slack or Microsoft Teams for casual check-ins. Have virtual water cooler chats. Have lunch together remotely. Create the in-office camaraderie, but do it remote. And I say it this way. What if it was, hey, every week we're going to have one lunch together, and every week we'll have one person pick what we're eating, and we're going to have it delivered to everyone's home via, one of the delivery services. Host your monthly virtual team building activities, such as online trivia, coffee chats. Strengthen relationships, but ensure remote employees feel connected to the practice's mission, vision, and direction. We need to prioritize employee well-being and flexibility. Support your remote employees' both mental and physical health by offering flexible schedules. So one of the things that happens in our thing is we have certain hours that are must work hours. We have certain hours that can be flexed to other hours. So if you're working an 8-hour day, 5 of those 8 hours have to be worked at a specific time. 3 of those hours can be earlier, later, however you choose to flex them. Be aware of overtime regs. So states like California, they can't do a 410 unless they're getting overtime. So you got to be aware of that kind of stuff. But I want you to regularly survey your staff to understand their needs, celebrate work-life balance by recognizing those achievements without expecting constant availability, fostering a culture of respect and care. So the other day, one of my employees, she needed to take her dog to the vet. She used her flex time. By flex time is she's like, hey, I'm going to go I got a 9 a.m. appointment and I'll make it up and I'll work an extra hour later in the day. Okay. Part of your flex time. 11 to 2, you're available for me. Before and after, you're going to choose your flex time. I'm prioritizing their employee well-being. I'm giving them flexibility. And at the end of the day, there's nothing that they're dealing with that has to get done at that exact time. Otherwise, it wouldn't be part of the flex time. Cultivate a shared sense of purpose. And we talk about this a lot. Align your remote employees with the practice's goals. Have them identify those goals. Have them wear them. Have them communicate them. Have them create a backdrop that really aligns with the purpose. Involve your staff in decision-making through virtual brainstorming sessions, feedback forums, empowering them to contribute ideas, because every time one of their ideas gets implemented, they feel more valued. Recognize that an individual and a team contribution in a newsletter or podcast shout out or whatever reinforce that impact. Create a motivated and unified remote workforce. And I think this is really crucial. I think that having your team feel, one of the things I recognize in my employees is they feel like owners of the company. They feel like stakeholders. They feel like they take pride in what that is, what that organization. I mean, even before this episode, I got a text from an employee and she's like, hey, there's this meeting. Are you going to be on it? I'm like, oh, no, sorry. And she's like, I got it. It's important. I want to be on it. I'm like, okay, thank you. Did she need to? No. Is it defined as a requirement of her job? No, but she sees ownership and she values that meeting on behalf of the organization. The next thing I want you to look at, gamify your connection between team members. Imagine a game via Slack where your team posts their favorite lunch of the week and pictures and recipes, and the team votes on who had the best recipe or whatever, and they win swag. What if you had it could be anything. It could be a trivia game that you play via Slack. What are the ways that you could gamify fun in a remote workforce connection? Empower your team to be part of a culture committee. I think that's really important. Letting your team define and build a group culture, having virtual culture meetings, having different opportunities of connection. And so one of the things might be, hey, once a year we go on a vacation as a team. We do a 2-day, where we're going to go hiking, we're going to go this, we're going to go that, whatever that may be, just to connect the group. And it doesn't have to be a retreat. It could literally just be a lunch, a dinner, an event. But it's really important that you only attract those that align with your employment culture. Because sometimes what happens is the employee wants a in-person experience, but needs to work from home. And there's a disconnect of fit in that example. So when we're measuring performance with our remote employees, we need to define outcome-based metrics, establish those KPIs. For example, they got a receptionist has to evaluate the response time from patient inquiries, the appointment schedule accuracy, how many appointments must be scheduled per week, tracking them using tools like Google Workspace or CRM, etc. So have those KPIs clear. You need to conduct your performance collaborations. So schedule one-on-one performance reviews. This could be monthly or quarterly via video calls to discuss progress, challenges, goals. Use a structured format to assess your KPIs, provide constructive feedback, set new objectives with your employee, not for your employee. Document discussions in platforms like Notion to track development over time. The next thing is we need to leverage project management tools like for visibility. So again, Asana, Trello, Monday.com, monitor that completion, show project milestones, assign completion acknowledgments, deadlines, deliverables, etc. If a marketing employee's campaign tasks can be broken into measurable steps, ensure that accountability is there without micromanaging. It's also important to gather 360-degree feedback. So what that means is you're going to different employees and you're having them evaluate different aspects of the business, the people, the staff, what's working well, what's not. What are barriers to function? Hey, I'm not trying to pick on Tina, but she's overseeing our scheduling and I feel like there's a disconnect and a time departure in how fast things are getting scheduled and it's impacting me. Well, that might not be Tina. That might just be the way that we've structured the scheduling tasks and we got to change it. So utilizing that 360-degree feedback. We need to monitor engagement and contribution in virtual settings. Evaluate how actively employees participate in team meetings, brainstorming sessions, virtual training. What is their involvement? Track metrics like attendance, idea contributions, leadership in projects using collaborative platforms like Slack or Zoom Analytics. Recognize proactive engagement such as staff member proposing a new patient outreach strategy. How are your team members contributing? What does that look like? So when we're managing compliance with remote employees, we need to deploy secure, compliant technology infrastructure. This includes our computers. We need to equip remote employees with HIPAA-compliant tools, encrypted telehealth platforms, encrypted email, file sharing, two-factor authentication, and regular software updates to protect sensitive patient data. We need to create and enforce a remote compliance policy. Really important that you have these policies in place for your employees. Provide ongoing compliance education, implement proactive monitoring and audits, and establish a clear incident reporting system. So important that you look at, there's dedicated platforms like Ethico and other things that can truly help with all this compliance function, but it's crucial. And recognize that we're not paying for the square footage, so we have to pay for extra tools and resources to accommodate these remote employees. And so when we're innovating your management approach to remote employees, I want you to look at things like Slack, look at things like Zoom for Healthcare, Google Workspace, Rippling's an all-in-one HR platform. There's so many different resources, and I invite you to really look and bring resources to this group. You can message me via any of the social media or email or whatnot. If you have different tools you like, I'm happy to share amongst all of you. And I think there's an opportunity here. And so we are creating an ecosystem of tools in the future to promote, but these are just a couple examples. Toggle Track, Hubstaff, Ninja One, Monday.com, all great tools that are out there. So did you know a 2025 forecast by Deloitte suggests that practices with effective remote management strategies can reduce turnover by 20%, saving approximately $10,000 per employee annually is what they're showing. Trust is the glue of life. It's the most essential ingredient in effective communication. That's what Stephen Covey said. Thank you for joining us in this episode of the Private Practice Survival Guide podcast. Don't forget, in order to survive in this private practice industry, you have to be willing to pivot. And so I invite you, reach out, ask questions, be part of this culture that we're trying to create in private practices, because I know it can change the way that healthcare is delivered. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you loved this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.